Hey, friends, welcome back. It's Michelle Lamoureux. I'm so glad you are joining me today. We are talking about something that many of you have curiosity about, and that is GLP-1 medications. Joining us today is Dr. Georgine Nanos, who is a board certified family physician and founder of Kind Health Group. She is a repeat guest because I adore her. And with over 20 years of clinical experience, she specializes in integrative and preventative care, combining traditional medicine with cutting edge treatments to support long term wellness. Dr. Nanos is a passionate mental health advocate, public speaker, and healthcare innovator focused on empowering patients and transforming the future of primary care. So, if you've been considering GLP-1s, just want more information about them, this is the conversation for you. Health is essential to playing your starring role, and I'm so glad to be welcoming Dr. Nanos back. It's so good to see you. Thank you for being here.
Thank you, Michelle. I always love talking to you, and I appreciate being your guest again.
And I will note, and I'm so glad you are back because the one you did on heart health was so good. And I've told my audience to send it to everyone they know. And I listened to it
Oh,
twice
good.
myself.
Yes, we shared it and have gotten so many comments on it as well. It was great.
Oh, that makes me happy to hear that. Yeah, I'll link that, by the way, ladies, in the show notes where all of the uh, things that we discussed today will be. But just I like starting foundational. What is a GLP-1? We've heard a lot about it, but I don't think a lot of people
Yeah,
even know what it
they
is.
are they're very much the rage. So
Yes.
GLP-1 medications, they mimic a peptide that occurs in our body. It's glucagon like peptide 1. So that's the G, the L, and the P. And this is a naturally occurring hormone that helps regulate our satiety, our insulin secretion, and then our gastric emptying. So that in normal terms, that means how full we get, the insulin that's secreted to help monitor regulate our glucose levels, and then how quickly our GI tract empties. And so these are really metabolic regulators. They're not weight loss drugs. They Weight loss is a side effect of what they do, but they really reduce appetite by changing the signaling from your brain to your gut. And it's not really just about willpower suppression. It's a very complex interplay between all of these hormones and signals in our body. So that's kind of the brief overview of what they actually are.
Okay. And why are we hearing so much about them now? How long have they been around? Because I got the sense they've been around for a while.
They've been around for almost 2 decades now, especially Ozempic. That was the first one. I was prescribing these at least 10 or 15 years ago. And they were initially indicated and approved just for diabetes. But what happened is in the last, I'd say, 4 or 5 years, they just became, they became very popular. They became popularized by celebrities. And so once that happens, kind of everything
Ah,
explodes. And so it
okay.
becomes part of pop culture. And they work really, really well. And what they do, they become popular because obesity and metabolic health is something that's been really hard to manage for, you know, for mankind and
Yeah.
womankind for all, since we've been around. It's been a difficult thing for people to harness. And so these medications just work very, very well, and they're relatively safe. And so that's why they've kind of exploded in popularity. And it's so much more than just metabolic dysfunction and weight loss. All of that is tied to our heart health, our bone health, our muscle health, all of that, our inflammation in our body. So if we can regulate our metabolism, lose weight, and do it in a way that's sustained, that has just a cascade of wellness effects for our body that is been unprecedented in medicine. That's why they're so popular. So it's not just about the weight loss, it's the dramatic improvement in blood sugar, improving people's diabetes and risk for diabetes, reducing cardiovascular risk. This is huge because we know, as we said in our last podcast, that's the number one killer. And that's been proven time again that GLPs are a huge player in reducing cardiovascular risks. And they just help people feel like they have their lives back and they feel in control. A lot of times, the overeating that happens in our lives is really can cause a lot of depression and a lot of mental health issues for people. It's kind of a two-way street. The depression and anxiety and stress also causes the eating, and then vice versa. So it kind of breaks you free too of some of those mental health challenges that come with food. Our relationship with food is very, very complicated.
It is. And you mentioned, you come from a Greek background and
Oh
mine's Middle
yeah,
Eastern. And so there's a lot of food is such a part of showing love. And it's just, you walk in and
totally.
you're going to be fed from the second you walk in the door.
Oh yeah. And if you reject it, God forbid, like I mean, that is like the ultimate sin. I come from a big Greek family, and in my world, it's all about food all the time. If you ever saw the movie My Big Fat Greek Wedding, I mean, that is the story of my life. So and I'm also the like classic Greek mother. If you come to my house, there'll be like 10 options for food. And yeah, everyone knows I'll always have enough food. But that's for me growing up, it was always a challenge. And I have personally have had a kind of modest struggle with my weight up and down over the years. And then as I had this cardiac challenge that we talked about in the last episode, finding out that I had some obstruction in my coronary arteries, I really decided that I had to double down and just get my weight to the most optimal level possible to reduce my risk to, the lowest possible level that I can. And so I started on tirzepatide, GLP-1, GIP, which is also known as Mounjaro and Zepbound. I did that a couple of years ago, and it really changed my life because, as I was saying, being raised Greek, the food noise is so intense. It's like, what are we going to eat? When are we going to eat it? Who are we going to eat it with? How are we going to make it? Where are we going to go? Like, what are we going to talk about? It's like, no matter what, it's all about food. And that food noise is real for a lot of people. And it's really one of the wildest experiences of my life to be free of that, because I just thought that was normal. And there are some people that don't experience it. But now that I don't have it, it's really cool.
Yeah, I think that's really interesting. And it's a beautiful part of the culture. And a lot of people
It
don't
is.
have that. And they love
Yes.
it. Like, walking into my mom's dad's house, my mom, she's going to feed you immediately, send you home with food. And I too have adopted a lot of that. I'm just not as good of a cook as she is, or enjoy cooking
Same,
as much
same.
as her. But there will
Yes.
be food and food will be offered. I will always be thinking about whether you have something to eat or drink. It's just, I think it's a
Right.
beautiful part of the conversation. But you're right in terms of this idea of food noise and, how do you manage that? Um, so as it relates to the GLP-1s, then has it changed like who's being offered it, or like how has your practice and practices changed? Like who's the ideal candidate? When is it the patient that's usually asking for it? Is it the doctor recommending it? Like what does that look like in clinical practice?
Yeah, certainly there is a wide range of people who are good candidates. Obviously, people who fall in the category of obesity or being overweight. And technically, in medicine, we define that as a body mass index greater than 30 is classified as obese, and greater than 25 is considered overweight. But there are plenty of people who have other conditions, like for myself, cardiac conditions that can benefit from optimizing their weight as low as possible. And it's not even just about the weight loss; it's also about inflammation. So certain conditions like PCOS, polycystic ovary syndrome. There are a number of other similar conditions where weight loss really does benefit, and at a very, very low level. So maybe those people don't necessarily need the highest doses. Doing like a small micro dose is enough to just keep that sustained lowering of inflammation throughout their bodies, and giving them a healthier lifestyle. So it is a kind of broad spectrum of people. Um, we kind of take each case as it comes. Yeah. So it's really an individual choice between a doctor and a patient. And I am very open-minded. Um, you know, there are some practices where like if you don't meet this strict criteria of being obese, you're not going to get it. And maybe insurance may not cover it for those people, but I believe that for everyone, I want them to feel comfortable in their body and to feel like they have control over their life. And a lot of that comes with how we eat and what we eat. And it really is a game changer for people in the most dramatic of ways. So, it's just an individualized conversation.
Yeah. And how are they administered? Is it still an injection? I read recently that they're coming
Yes.
out with pills.
Yeah. So right now they're currently administered as once a week injections. So, and there's really only two drugs that we're talking about here. We're talking about GLP-1 or semaglutide, that's also known as Ozempic and Wegovy. And then the other drug is GLP-1 GIP, also known as tirzepatide, Zepbound, and Mounjaro. So two drugs, eight names, just to make it really confusing for
Okay.
people.
I didn't
So
realize there was only two drugs. See?
yeah,
Yeah.
yes. So these are the most common ones that people are talking about, and they're administered once a week by injection. And the Ozempic tends to have a few more side effects than the Mounjaro or tirzepatide, and so most patients now tend to prefer the tirzepatide. Ozempic sometimes causes a little bit more nausea, some more constipation, and often a little bit more irritability. It's cheaper to obtain. So if people can tolerate that, fine. But most people prefer the Mounjaro, which also confers a little bit more aggressive weight loss in the beginning. So that's kind of the chief difference between the two. And yes, in 2026, there are lots of drugs in phase 3 trials right now for oral administration of these medications, which is going to be a huge breakthrough because a lot of people really can't tolerate the injections or just not don't want to inject themselves once a week. So when that
Yeah.
happens, it's going to be game on. Like everyone's going to be having better access to it, which is exciting because so much of what of the health problems in our world right now are tied to obesity. Obesity causes, is one of the leading risk factors for all forms of cancer as well as heart disease. So, as well as joint instability, chronic pain. There's so many things that are associated with obesity. So if we can cut that off, that's going to lead to a much healthier population across the board. So it's very, very exciting.
Okay. Who is it not for? Just somebody who's not obese? Because you mentioned the word food noise. So like who would you and I even think about, can we include children here? Because it seems like
Oh
there's a
yeah.
desire to use this for kids. And, I don't know, you're the doc. So I'm curious, like, how do you think about it? Because I think, there's obviously the criticism, like, why can't people just go exercise and eat better? It's not about that, is it? I mean, tell
No,
us.
no, not at
Yeah,
all.
yeah.
So the idea is you should be exercising and eating better. And there are lots of people who do all of those things and still can't get the weight off. I was certainly one of them. And it's, you want to also be optimizing all those other aspects of your life. So it's not like this is a substitute for that. This
Uh,
is a way to augment that journey and to give you a more powerful tool in your toolkit so that you're really attacking it from all angles because it is a complex metabolic dance that you're doing, and all the exercise sometimes and all the dieting that you do, that people do, and food choices still can't get them to where they want to be. So when people are on GLPs, they're still eating. You can still eat and enjoy life, but you're going to make it kind of quiets that food noise in a way that you gives your brain space to make the right choice. So
mm,
you're not like starved with hunger or like having these cravings that feel out of control. Yeah, so for a lot of people, women in particular, especially around menopause, that
yes.
metabolism comes to a grinding halt, and they feel so stuck because their whole lives, for example, they've been able to maintain their weight and do everything that they normally do. And all of a sudden it's like, bam, there's like a brick wall and
Mm.
you're not getting anywhere and you're gaining weight. And so these are a lot of our patients as well who are right at that phase in life. But it's not taking away all of your hunger cues. It's really just quieting things down so that you have the wherewithal to kind of make those better choices. And you're still going to eat. You're just going to eat a whole lot less, and then you have the time and space in your brain to make those right choices.
So you still have
So that's
normal
really the
hunger.
difference.
Yeah, I'm just curious. So you
Yes.
actually do have hunger. If you see something that normally you would love to have, you still desire it. Like, what is it
Yeah.
actually doing
Yeah.
in the
Yes.
brain? What do
Yes.
we know? Like,
Exactly.
what's happening in, like, what does it do?
Yes, it's working on your dopamine receptors in your brain, which are
Oh,
your
wow.
which is controls your cravings. It's this network and circuitry that impacts like how you crave stuff, and it's same way dopamine affects interplays with like drugs and alcohol. Food also is in that network, in that circuitry in your brain, and so it's down regulating those dopamine receptors so that you're still like excited about a particular food, but you may not eat like a whole box of cookies. You may have one or two, or like, you may not eat a whole plate of mac and cheese, but you'll have a couple of bites. So it's that's really how it works. You're still going to enjoy the food. You're just going to enjoy it at a much healthier level.
The correlation to the other things you mentioned, like helping so that your blood sugar and your risk of diabetes, which is the precursor to other issues, health issues.
Hmm.
And there was a recent study, I think they were hoping that it was going to also help with Alzheimer's, but the mechanism for that I probably was kind of related to how it helps with the heart too. Is that right?
I
Meaning, go
No, I
ahead,
think
please.
that's more with inflammation, and so
Ah,
there's so many factors that Alzheimer's and dementia is very multifactorial, and and inflammation is one of those. Oh, and poor diet also contributes to dementia, and so as does obesity. So obesity really is like the worst. I mean, it's like as bad as smoking for us, and
I
so
see.
being even slightly overweight is just so terrible for our bodies. And so anything we can do to downregulate and modulate these metabolic pathways that take us there is a win. And so
Okay.
that's why there's so many broad applications for people, and beyond just the vanity of losing weight. It is a massive breakthrough in medicine, and we're going to see even more success stories and more applications for it as time goes on, for sure.
Okay. Now, obviously, anything that, these medicines, anything can potentially have side effects. And so, what are the
Right.
most common in women? We hear about hair loss, something called Ozempic face, which I
Yeah.
don't even know what that is, and loss of muscle, which obviously is
Yeah.
critical to address.
So
So, please.
yeah. So the most common mild ones tend to be nausea, constipation, some fatigue. Um, and less common, but also important, are gallbladder issues, pancreatitis risk, and then severe delay in gastric emptying, which is very severe constipation. So that's
Hmm.
why it's really important for, so everybody's selling these GLPs if you're not getting them from your doctor, but it's very important that you get them from licensed medical providers that know what they're doing. So it's important that they check all your labs ahead of time, that they screen you for kidney disease, they screen you for gallbladder disease, pancreatitis, and then also much more rare condition would be a family history of medullary thyroid cancer. Um, and so making sure that patients don't have those conditions in their history. So for the most part, the contraindications are pretty few, and the side effects are not very dramatic. But for example, we give all of our patients some anti-nausea medication when they start. We really counsel them to make sure they're drinking tons of water and that they're monitoring their stools. If they're constipated for more than one day, they need to let us know right away, because the constipation is a big deal. So we do often recommend stool softeners in combination with this therapy to make sure that you don't get backed up, because it's really just slowing things down so that you feel full. That's part of
Ah,
how it works.
oh,
But
wow.
you also don't want to, it's kind of a fine balance. So you got to make sure that you're still going and pushing things out. So, and then, as you were saying, the long-term effects on muscle composition are real. And so, and this has really nothing to do with the drug itself. Anytime you're going to lose weight, no matter how you do it, you're going to, unless you're actively working on your muscles and strengthening them, you're going to lose muscle mass. And so it's not just about the drugs that's doing this. It's the sheer act of significant weight loss that's happening
Okay.
here.
Yeah.
And so when people talk about Ozempic face, I mean, we see this all the time in people who lose weight. Like, you're part of our face has fat in it, and so when we lose weight, everything starts to drop a little bit. So people call it Ozempic face, but it's really just general weight loss face. Now
I
there's
see.
so much of it, so we stick a label on it, but that's what happens with weight loss. And so, yes, it is important that we counsel all of our patients that they're making sure they're getting enough protein and really doing some resistance work and muscle building, because it can be dramatic. So that's a big piece of it.
And how long is someone on it? I think you mentioned that you didn't like you were on it for a certain amount of time for your heart. Are you still on it
Yeah.
you
I just injected myself about 2 minutes before I got on
Oh, you
this
did. Okay, okay.
podcast. Yeah, yes,
So is it a
yes.
lifelong commitment? Like, I guess I'm wondering how long
So
somebody
it
figures
it
out.
it kind
Yeah.
of depends on the person and what they need it for, how they are doing. So, for example, like for me, I know myself, this has changed my life so dramatically. I want to be on it for the rest of my life, because it's the best, one of the best things I've ever done for my health. So I don't take it as much. I've spread out the dosing. I take it maybe once a month. Like, it's been about a month since I did it, or sometimes I'll do smaller micro doses throughout the month, instead of doing like a bigger dose. So there's so many ways to customize the dosing. So the goal is kind of to titrate people down once they get to where they need to be and they feel they're at their goal, is to titrate them down to the lowest effective dose to kind of keep them there. And some people do go off of it, but there are a lot of people that feel so good on it. You just feel so in control of your life. It like really kind of frees up brain space, so that you're
Yeah.
not like thinking. It's so weird to describe, but it is a real phenomenon where you just feel like you don't have to worry about, okay, am I going to overeat and kind of do mess things up for my body. So it does, it's a relief to have that drug available. And so a lot of people don't want to get off of it, but like any drug, I'm not a huge fan of medications. um the key is to really, again, be on the lowest dose to treat those symptoms and maintain, or if you can space it out and get off of it, that's great too. But we have so much safety data for these medications, like more than 2 decades now, that it's not, it's pretty reassuring.
Yeah. And healthcare costs what are like in the billions, right? To like manage all these diseases. So
Oh,
hopefully it'll impact that aspect of it, right?
yeah.
Are you hopeful for
Yes.
that as a
Yes.
doctor?
Oh my
Yeah.
God. Yes, absolutely.
Just because
I
that impacts
mean,
the people. It's not, I don't care about the industry. I care
yes.
about the humans that, yeah,
Yes.
behind those
Yeah.
numbers.
No, the
Yes.
humans, we are all the humans behind those numbers. Like I was saying, cardiovascular disease, cancers, dementia, like, musculoskeletal issues, rheumatologic issues, endocrine issues, everything downstream from obesity can be, relieved. And so it is so exciting. It's really like truly a miracle drug.
And how quickly do people see results? So once you start, like how soon,
Um,
say,
like pretty
yeah.
fast.
Oh, it
So
is. Yeah.
yeah, within, I'd say, usually within a week or two, people are seeing some pretty dramatic changes. Men, of course, tend to lose weight a lot faster. So men will see a pretty significant change within those first couple of weeks. Men sometimes lose like 20, 30 pounds in a month. Women a little bit less so. And again, it kind of depends on your starting point. and your habits. And so the people who are exercising and eating well to begin with, they're going to have
Yes.
far better outcomes than those that are doing nothing. So really, this is one tool in your toolkit, and if you're optimizing all the other things, you're going to do much better.
And are there contraindications with other things that like people can't take it because of that they're on other medications or anything or no? Like, do they have the safety data on
Typically,
that? Yeah,
I mean, typically no, because what happens is people tend to most people are on medications from something that comes from them being obese, whether it's your blood pressure medication, your cholesterol, those kinds of things. So very often what happens is they get on these GLPs, lose all the weight, and then we can really remove a lot of the other
that's
medications.
interesting.
So that's really the big upside. There aren't a lot of contraindications with other medications. The one major contraindication is during pregnancy, obviously, but there are a lot of women that, right after they finish pregnancy and breastfeeding are able to go on GLPs and then feel like they're kind of getting their life back and their body back. So that's a big upside too.
I didn't even think about that they may
Yeah.
be getting off other meds because of the weight
Yeah.
loss, right? That's
Yes.
interesting.
Yeah.
Yeah.
That's the biggest thing we see, and that's really rewarding to me to be able to take off that blood pressure medicine, that diabetes medicine. They're no longer diabetic. You get them down to a level where everything vanishes. All of these conditions, they just go into remission. So it's really really cool. It's wonderful to see that we have something that can do this for people. The thing that I wish people knew is that I mean, I want people to know all of this because there is a lot of judgment for people who choose to be on GLPs. A lot of people, are like, oh, you're just doing it for vanity, and there's so much more behind it than that. Vanity is kind of the least of it from my perspective.
Yeah. No, I think that's an important message. How expensive are they? You mentioned something if your insurance covers it. So does
Yeah.
insurance cover it? And yeah, and if they don't, like how expensive are those injections?
So that's getting better every month. And there's a lot of pressure on the manufacturers. Eli Lilly is the manufacturer of Manjaro, and that's the second one that we were talking about, a little more effective and the more popular one right now. And so they just lowered their price last month or a couple weeks ago down to $299 a month for direct pay. This is for the lowest dose. So about a year ago it was $1,400 a month. This is
Wow.
this is a massive reduction in price, which there's been a lot of political pressure to bring it down. Interestingly, in other countries, while we were at like $1,200, $1,400 a month, like France and Europe, they were like 75, $125 a month. So the twist of like big pharma exploiting the American population for this has been just disgusting.
Same
And so
companies? I don't mean to
same
interrupt you.
company.
Same company.
No, yeah, no, same company. They sell it to the European Union for like pennies on the dollar while we're paying like $1,200, $1,400 a month. So anyway, there's been a lot of pressure to bring it down, and that is happening. So I'm very excited about that. So they brought it down to like $500 a month in the summertime, early summer, and now just a few weeks ago, it's down to $299. And insurance coverage is spotty still.
Depends.
It's really for obesity and diabetes that they'll most usually cover it for. But as this direct to consumer pricing comes down, it's going to be widely available for everyone. Hopefully, by the end of 2026, I think we're going to see broad coverage all across the board, and that's going to be a huge breakthrough for people. I think every single American should have access to this if they want it.
Yeah, you feel that passionate about it. That's so good to know. This is why I had so much curiosity around it because I'm
Yeah,
hearing so much. And now with the oral medication, if, to the degree it works and they can figure out it's
yeah.
effective and just the same safety profile, I imagine that's going to lower the cost too.
Yes, yes. There are some oral formulations of Ozempic that are out there currently, just to be
Yes.
clear for your audience. They are
Okay.
not as effective and they have a lot of side
Uh,
effects. So that's not what we're
oh,
talking about. We're talking about
right.
like a next generation drug.
Exactly. Right.
So, yeah. So if you
Oh,
see like oral Ozempic, don't bother, don't waste your money. It's
wait.
not right now. It's
Yeah.
not, just wait, just wait. I mean, if you get great results from it, fine, but like on the whole, it's not worth it. Right now, those injectable drugs are really the only ones that are worth it, and are you're seeing the results from the oral. It's just not that great,
Yeah.
and the side effects are much greater right now.
Um, what, because this is a conversation, I've wanted to have, but I don't obviously know much about. What am I not asking you that is worth mentioning today?
I think we covered a lot. I think for me, it's also, as I was saying, you making sure that you're having these conversations with real clinicians. Everyone out there claims to be, a hormone or weight loss expert.
It's true.
It's so easy on Instagram to just put up a little virtual shingle and call yourself an expert. There's a lot that goes into managing people on these medications and doing it very, very safely. These are very, very powerful drugs. So I encourage you to make sure you're seeing someone who is a licensed provider and knows what they're doing. So I think that's a big, big thing right now. Um, and then, like I was saying before, the stigma, the judgment, we need to stop. We need to completely stop that, because there is this, as I was saying, has such an impact on people's lives and their longevity and their health and their happiness. And it's really a good thing.
Yeah. Okay. I just thought of actually one more question. Do you hit a plateau with it? So once you've been on
Sometimes,
it, or like, how
yeah.
do you
So
know when
this is a
to like taper off or whatever? Yeah.
That's a very good question. So,
Yeah.
every when we start people, everybody starts at the very lowest dose. For example, like tirzepatide, the lowest dose is 2.5 milligrams. Everybody starts there. I don't care how big or small you are. That's where they start, and then we administer it once a week for you stay at least on that dose for 4 weeks. At the 4 week mark, if you feel like you've plateaued, or you can go, or you're not at your goal, then we try trade up another. We double it to we go up by 2.5 each time. So the next month you'd be at 5 milligrams, for example, and we reassess you every week. We make patients come into our office every week, have a conversation with them. How are they doing? How's their exercise? How's their diet? It's a very comprehensive overview of the week, and where they are. And we do it very supportively, obviously without judgment. And then if I go down, and it's a individualized decision with patients. The max dose is 15 milligrams, and so that's as high as you can go on tirzepatide. And then there are months where people may plateau; they may not lose any weight. And then, because it's not like a straight downward slope. There are plateaus along the way. And maybe people go on vacation, or who knows, like life throws you challenges where you're going to
Yeah.
eat more, like graduations, parties, so holidays, for example. So it's always a conversation, and it's always evolving. And honestly, I can tell you, we have hundreds of patients on GLPs in my practice right now. No two are on the same regimen. No two,
Okay.
for sure.
Really? It's
Like,
that?
it's yes. Yeah, if
Okay.
you're doing it right and you're really listening to your patients, everyone's on a different track. And I think that's an important message for your audience too. Like, you should find a provider that can work with you and really develop a customized plan that is tailored to you and your needs, and what you're going through. And that changes all the time.
Okay, this is so good. Before we wrap up, since this is inviting women off the sidelines into her starring role, what advice would you give to women as it relates to their health and really prioritizing it, both as a woman and as a doc, who's been on both sides, right?
Yeah, I think as women, you and I were talking about this earlier. We always tend to put ourselves last, and to give and give and take care of everyone else first. And this is our time to really put ourselves first, take that starring role, and prioritize our health, and to advocate for ourselves. So many women, think of dismiss their own symptoms. That could be, that's your intuition. That's your women's intuition that's sometimes whispering to get you to do something. Listen to yourself. You know yourself. You've been in this body. So if something doesn't feel right or sound right to you, and you go to a doctor or a provider and get dismissed, go to somebody else. Like, we have to advocate for ourselves as women. We have to put ourselves first. This is the only way we're going to be able to keep keep the world afloat as we do, because we are the most powerful beings. We bring life into this world. We take care of everybody. We make all the magic happen in everyone's lives. And so it was time we make some magic happen for ourselves. So please, please take good care of yourself.
So beautiful. I really received that. Thank you for saying that. Doctor said, listen to her, ladies. The docs has
Yes.
told us. Where can my audience learn more about you and your work in case they want to
Yeah.
check you
So
out? Yes.
we take patients virtually from all around the country. So kindhealthgroup.com is our main website. At Kind Health Group is our Instagram. At Dr. Georgine Nanos is my Instagram. We're on LinkedIn. We're on YouTube, Kind Health Group YouTube. I have tons of shorts and videos and all those things on there. I also have a podcast called The Kind Revolution, where we talk about new ways to approach healthcare. I don't think we've done a GLP talk, so yeah, I gotta get that
No,
on
no,
there.
no, you're gonna
We'll
get
put
there.
this
You
one
can
on
put
there.
this one.
Yeah,
You can. I was
I'll
gonna
put this
say,
one on there.
yeah, go ahead.
Yeah.
Yeah, for sure.
So, yeah.
Awesome. And
So,
ladies, give Dr. Nanos a follow. And if you enjoy or learn something, we'd love to hear from you. So when we post this on social, share it.
yeah,
Same with the heart one. I think this is how we lift each other up and we keep ourselves front and center and keep each other accountable too, is just reminding, say, hey, I thought of you, with this heart health conversation or this, GLP-1s. Did you know this information? Just to share information in a
yeah.
way that's supportive of other women. And all of the show notes, as you know, ladies, are on your podcast player with direct links to everything that we referenced today. Dr. Nanos, you know that I'm such a fan of yours. So thank you for being here. And you
Oh,
do have such a
likewise.
kind heart. So thank you for your kind heart and for coming back on the show today.
Thank you so much. It's been an absolute pleasure. I can't wait to do it again.
Yeah, me too. Me too.